Namaskar दोस्तों, welcome to channel Toxicology on Board. Today in this video we'll be discussing another important topic that is uh, National Health and Nutritional Examination Survey, that is NHA-NES, which is a part of ABT brochure. I'll show you where that given in the syllabus. So let's quickly go through what is the NHA-NES. National Health and Nutritional Examination Survey is a survey research program conducted by the National Center for Health Statistics. Okay, this is called NCHS to assess the health and nutritional status of the adults as well as children in the United States and to track changes over a period of time. Okay, so this is the survey. They have different type of surveys will be there. We'll go through the website also what it is. The survey combines interviews, physical examination, and laboratory test. The NHA-NES interview includes demographic data, socio-economic, dietary, health related questions in that particular questionnaire will be there. The examination component consists of medical, dental, physiological measurements as well as laboratory tests which are administered by that particular medical personnel. This particular thing, no, it comes under National Health Survey Act, which was passed in 1956. This allowed legislative authorization in the US to provide current statistical data. So, at this present year, what is the current statistical data in which there are diseased population based on that particular reforms and what is it, um, will be facilitated to the particular population. Okay, provide current statistical data on the amount, distribution, and effects of illness, disability in the case of US. So we till now know the first three national health examination surveys were conducted in the 1960s. So in from 1960 to 62, they did the first national health examination survey. 1963 to 1965 National Health Examination Survey 2, and similarly in 1966 to 1970 they did the NHS third survey. The first NHA NES was conducted in 1971. If you can see, the act was passed in 56. Okay, and in 1999 the survey became an annual event, and the first report on the topic was published in year 2001. So I would request you to go back and check their website. It comes under Center for Disease Control, CDC. In that website, it will be given National Center for Health Statistics. Okay. So NHA-NES findings are used to determine the prevalence of major disease. Means in that particular sector of population, how frequent the disease is coming, how much amount of the population and which particular type of population are subjected to that particular illness. So by gathering these data, they will then assign what a kind of facilitation that to be given to that particular population. Okay, prevalence of the major disease and risk factor for the diseases. Okay, is there any contamination in that particular area, like drinking water or soil contamination? Okay, information is used to assess nutritional status, whether that particular set of population are malnourished. Okay, and its association with the health promotion and disease prevention. Okay, before how can we prevent the unaffected population? Okay, NHA-NES findings are also basis for national standards, and for such measurements, height, weight, and blood pressure, all these different parameters will be there, which will be part of that particular questionnaire. NHA-NES data are used in epidemiological studies and health sciences research, include biomarkers of aging, which have developed sound public health policy, direct and design health program and services, expand health knowledge, extend health span as well as lifespan of a particular individual. Follow-up studies should be there. Once the survey is done, there should be follow-up study. Follow-up studies using NHA-NES data are made possible by creating linked mortality files and files based on the Medicare as well as Medicaid data. Okay, everything this information you will have in their website. It is given. Okay, so CDC, that Center for Disease Control, they have given this extended BMI for the age growth charts. Okay, as I told you, this is a part of ABT brochure. You can check in the brochure 2026 handbook they have given. So if you look into the syllabus, no, it is a use population based biomonitoring studies to ascertain temporal trends in the case of environmental exposure. So always when the data you start collecting, no, you need to see dose trend, whether cause and effect relationship is there in that particular set of group of population. If there is certain disease, what is the cause, is it directly associated with that particular effector? So that type of data, it comes under this, a certain temporal trend in the case of environmental exposure. Population level national studies and databases, that is the reason it is a part NHA-NES. This is, I'm talking with respect to US. They are given one example. Maybe in European country some other will be there, in some other Asian country some other database will be there. Cross-sectional versus longitudinal epidemiological studies. Okay, how you collect the data over a period of time. That will comes under cross-sectional and longitudinal epidemiological studies. That's why I always say you have to read about case control studies, cross-sectional studies, retrospective studies, all these things studies. From that you will be getting the data, and that data, based on the trends, you will be inferencing the how you can apply it for your risk assessment. Okay, risk management. Toxicological implications of biomonitoring data reporting as a part of community public health investigation. Once you know, then you can see here, you can train the individuals, you can educate that particular group of population. Okay. That is, see, design health programs and services, expand health knowledge, extend the health span as well as lifespan. So this is an example of a this survey questionnaire survey from the NHA-NES. You can see here they have different questionnaires. In the questionnaires also, you see, for with respect to depression, no, the different categories they have given, and different kind of age individuals they have given, and they have categorized MEC as a different type of examining is there, like mobile examination center is there. Okay, national health and nutritional examination survey is there, like, okay. So different type of survey programs will be there. So this is their website. This is National Center for Health Statistics. Okay, in that you have various subtabs. You can see that results and publication, biospecimen program, serum plasma and urine specimens, and they also frequently conduct webinars with respect to whatever the new change they are doing in that particular organization. And you can see here the questionnaires and data sets, all these guidelines, how to collect this high quality analysis of this NHA-NES data and survey methods. So you can explore the subtypes, search variables, frequently asked questions, survey methods and analytical guidelines. Okay. And in addition to that, these are the guidelines for high quality analysis of NHA-NES data. Here you can see they have given the interview, dietary, exam, laboratory data. This type of questionnaires will be there. They're going to collect biospecimen also, survey participants, all this. But all this information will be again confidential. They'll not disclose the individual information. Okay, and this is the latest one, what they have, NHA NES 2025 and 26. Here you can see data, demo, documentation, and code books. Your dietary data is there, examination data, laboratory data, questionnaire data, demographic data, which is a part of syllabus. Okay, using the data, you can make survey methods, analytical guidelines, responses, rates, and population totals. So hope from this video you will be able to have a quick revision about what is this NHA-NES, how in the case of epidemiological data is important, the temporal trend. Okay, most of us might not be aware of, because you have to understand this exam is set up by the American board. Okay, so some of the questions which are related to that particular local area, one or two questions they might ask. So for that reason, since they have already mentioned in the brochure examples of NHA NES, then better we need to have awareness of what is this particular NHA NES. Okay. Thank you so much. Be curious. If you have any questions, you can always write a mail to arya.priyanka18@gmail.com. All the best for your exam.